This podcast is talking about safety and hair restoration surgery. We are too often focused on a beautiful result, but I would say that for me, one of the big things is safety and comfort, and those two topics are not often discussed. So the first thing, let's talk about what concept covers these two. Really, the idea that we operate probably one of the few places in the United States, if not the only one in Texas, that works in a fully accredited surgical facility where we perform hair restoration surgery. The benefit of this is that our patients are very comfortable and they are also very safe. Now, of course, safety is a relative term. You have to choose the right patient. You have also be able to handle emergencies if they should arise. But 99.9% of surgeries are done outside of our office in other words, in other locations in a regular office. So one is that they are not allowed to do anything more than just some local anesthesia, some injections, which is very, very uncomfortable. And the second of all is that there's no real hemodynamic monitoring or cardiovascular monitoring during the procedure. We have a Joint Commission Accredited facility. You can Google what that means. It's the highest standard out there in terms of accreditation. Very rigorous. In fact, we've gotten amazing reviews when the reviewers have come through here. In fact, there was a patient that recently had a procedure locally in Dallas at another place that had an issue with a cardiac event or heart issue, and the doctor said, go to Dr. Lam, he's safe. And they had to cancel the case. And he came over here. Of course, he's going to get cleared. I'm not going to just operate on a patient without figuring out what's going on. But clearly, if he was not safe, I would not be operating on him. But the difference is that other doctor knew that we're practicing safe hair surgery. So he said, go to see Dr. Lam. So we have ER nurses that also I work with that can handle emergencies with me. And so there's so many things in terms of safety. Patients monitored for the procedure versus just being totally not monitored at all. We have emergency equipment, transfer protocols, everything in case there's a problem. In addition to that, we have all the medications that we need to counteract a problem. And we also allow for the next portion of the discussion, which is comfort. The comfort is such a huge thing. You will probably need another transplant in your lifetime, especially if you're younger. And most people tell me when they've been elsewhere that was such a miserable, horrible experience, they would never do it again. And a huge thing for us is that there really is very minimal to no discomfort because we're able to provide a little bit of what's called conscious sedation or level 2 conscious sedation, where you're still able to talk to me, but you don't feel the discomfort. It's such a difference in terms of the way that day feels. So I always say it's instead of flying over to London, it's like flying over to North Carolina. It's a shorter distance flight. I guess if you're a UK person listening to this, then it'll be a little different, but I'm just talking about a US flight, domestic versus a long flight. You don't feel the weight of time. You don't feel the anxiety. You don't feel the needles. You don't feel the pain. And that means the next time you have to do a procedure, you're not going to be so alarmed or worried. Example, I recently had a colonoscopy. They said, okay, we're going to start. The next thing I know, I was in the recovery room thinking, I don't feel anything back there. What's going on? I didn't even know I was in the recovery area. Well, that's the same type of experience you should have with us. When you can contrast that with what people experience elsewhere, where it's miserable, all day long miserable, it leads to a psychological distress that you don't want to repeat. And those are the concepts of safety and comfort I want to discuss in this podcast.